Senator Black, your item.
Thank you,
4 minutes.
I would like to say thank you to the Minister for coming in this morning, and also to congratulate you on your new post, Minister. Well done. But I suppose this is something that I'm extremely passionate about, the alcohol issue here in our country. And I know I read out these facts and figures yesterday in the order of business, and so forgive me for reading them out today. But I was, this is when I started to look at the Health Research Board's National Alcohol Survey. I was absolutely shocked at what I had found. And I'm just going to give you some facts and figures, if that's okay, Minister. So more than 150,000 Irish people are dependent drinkers, more than 1.35 million are harmful drinkers, and 30% of people interviewed say that they experience some form of harm as a result of their own drinking. The report also reveals that 75% of alcohol consumed in Ireland is done as part of binge drinking, and we underestimate what we drink by about 60%. So I believe that the point in this is that there is a massive unmet need, and alcohol-dependent individuals need psychosocial intervention and therapy, and hazardous drinkers or harmful drinkers need brief interventions to minimise the chances that they will progress to dependency. And I think that's just an important point. But I just want to give you some more facts and figures, if that's okay, because they are quite shocking. 88 deaths every month in Ireland are directly attributed to alcohol. That's 3 people a day in this country are dying. It's frightening. There are almost twice as many deaths due to alcohol in Ireland as due to all other drugs combined. 900 people in Ireland are diagnosed with alcohol-related cancers, and around 500 people die from this disease every year. Alcohol is a factor in half of the suicides in Ireland, and we know we have a huge problem with suicide, but the fact that alcohol is involved in half of our suicides is horrendous. Alcohol is also involved in over a third of cases of deliberate self-harm, peaking around weekends and public holidays. Over 14,000 people were admitted to the liver unit in St Vincent's Hospital for treatment of alcohol dependence in 2011. Every day, 1,500 beds, this is every day, in our hospitals are occupied by people with alcohol-related problems. And this is another shocking factor here. Alcohol-related illness costs the healthcare system. It did cost the healthcare system 800 million in 2013, and I think it's even more now. So these are just a few stark figures from the Health Research Board's report on alcohol harm. And behind these figures are thousands of family members who require support and guidance in dealing with the stress, anxiety and heartbreak of having a loved one with an alcohol problem. Like, if you're a concerned family member or identify yourself as having an alcohol misuse problem, it really is difficult to access services, and this is my concern. The first port of call for many is the internet. If you're sitting at home and you're really anxious about somebody that might have an alcohol problem, or if you have an alcohol problem yourself. And there's a fantastic website which is provided by the HSC called drugs.ie, and it really is amazing, I have to say, and I want to commend all the people who run that service. But I did a search on drugs.ie, and I specifically looked for supports that specialise in solely alcohol dependency. And when I looked in counties Donegal, Galway, Wicklow, Limerick, Cork and Wexford, the only service that came up were Alcoholics Anonymous and Alateen, which are peer-to-peer support groups. Now,
Senator,
sorry?
you have 1 minute.
Oh, sorry. So based on the startling and worrying facts linked to alcohol misuse, this is a very worrying indication as to lack of support we are offering our citizens. By not offering early interventions, we are prolonging the agony for the person and the family. We are allowing the problem to escalate over time, increasing the heartache for all concerned, as well as giving the HSE a much larger and more difficult problem to deal with in the future. And can I just say, a report was commissioned by the HSE, chaired by Des Corrigan from Trinity, and said there was a severe under-provision of residential places. The same report also recommended that the mixing of alcohol and other substances in terms of location and treatment should be considered more or less on county-by-county basis with input from service providers. We know the benefits of alcohol-only services over mixed substances in some settings. I would suggest a minimum number of treatment places be set aside for alcohol services, and that the ratio of alcohol-only versus mixed should be discussed by all involvement in treatment. Funding should be earmarked for these services. Finally, Minister, the National Drug Strategy is being rewritten at present, due for completion by the end of the year. My concern is that if alcohol is not included, it will be forgotten about. Funding for that needs to be in financial estimates that are currently being put together in advance of the budget in October. Minister, as you know better than I do, a lot of alcohol-related harm is hidden and does not reach the public realm. Self-harm, gender-based abuse, physical abuse, sickness, absence from work, economic desolation. The published harms represent a minimum level of real harms are higher. Therefore, I'd like to ask you, Minister, to give us an overview of what support the State offers to those who have a problem with alcohol and particularly their families. Thank you, Minister.
Thank you, Senator. Minister.
Thank you, Senator. I'd like to thank Senator Black for raising this matter and to acknowledge her good wishes to me in my new role. And I'd also like to reassure the Senator that this government is committed to tackling alcohol misuse in Ireland and are very cognizant of the widespread harm and pain that it causes. Alcohol is causing significant problems across the population in workplaces, to children, and it carries a substantial burden to all of us in Irish society. The Health Service Executive provides services to prevent and treat addiction to alcohol. People who present for alcohol addiction treatment are offered a range of interventions, namely initial assessment, comprehensive assessment, the Minnesota programme, brief intervention, individual counselling, self-help, peer support, or a combination of these depending on the individual in question. The delivery of these services is based on the 4-tier model of treatment intervention, and services are designed to respond to the individual's specific identified needs. This care model implies that the clients should be offered the least intensive intervention appropriate to their need when they present for treatment initially. Interventions range from community and family-based supports through to primary care services, through to specialist support services either in the community or in residential settings. Interagency working between the HSE, the drug task forces and multiple other community, statutory and voluntary agencies form the basis of this delivery, as the target is to provide services where possible in a community environment. Counselling and rehabilitation services provide care to those presenting with an addiction through one-to-one counselling and onward referral to other statutory and voluntary groups where appropriate. The HSE also provides funding to a number of voluntary service providers who treat alcohol and drug addictions. The remit of the drugs task forces was extended to include the problem of alcohol misuse in 2014, in view of the central role they play in coordinating the response to substance misuse level at local level. Last year, 5 drug and alcohol task force areas developed implementation plans to reduce alcohol-related harms, with a further 5 drug and alcohol task forces developing implementation plans in 2016. So I think you'll acknowledge that that's something that you were interested in. The experience of children living with and affected by parental substance misuse has become widely known as hidden harm. These children are often not known to services and suffer harm as a result of their parents' substance misuse. The importance of recognising hidden harm and ensuring that these children are identified and supported at an earlier age cannot be underestimated. The HSE's addiction services and TUSLA have collaborated on the development of a hidden harm strategy statement. The statement is due to be published shortly, will address what needs to happen to create the structures, processes and continuum of care to effectively respond to hidden harm. In addition to providing services to those impacted by alcohol abuse, the Government is working to reduce alcohol consumption and to address the underlying causes of alcohol misuse, that is the affordability, the availability and the attractiveness of consumption of alcohol. The Government approved the publication of the Public Health Alcohol Bill and its introduction in the Houses of the Oireachtas last December. The bill completed second stage in the Seanad on the 17th of December 2015, and I expect that it will commence committee stage early in the next term, and I'm anxious that it be prioritised to resume through the Houses of the Oireachtas in the next term.
Thank you, Minister. Would you like a supplementary, Senator?
Thank you, Minister. And I do welcome the legislation going through for the alcohol bill. I think it's fantastic, and I think it will start the conversation going. And I also welcome the hidden harm report. I do think it's vital that implementation is done, particularly around children who are living in homes. And it is hidden harm. I mean, nobody really understands the impact. And I know myself, I work with families who have loved ones with an alcohol, drug or gambling problem, but our main, I suppose, issue is alcohol and the devastation that it causes within the family. But when somebody wants to step into recovery, they really do find it difficult to find a service. Unless, when a family comes to the Rise Foundation and asks, where can we get our loved one, where can they go, they find it hard to access services, particularly if they're in Donegal, if they're in Galway. There's lots of counties around the country that they just don't know where to get the support. Now, we ask them, we refer them on to the site drugs.ie, but it's still very difficult to get somewhere that solely deals with the alcohol issue. In Ireland, we have a huge unhealthy relationship with alcohol. It's horrendous to see people every single day, when we think of 3 people a day who are dying with an alcohol-related issue. So it's really, really important that this issue is taken on its own, separate from everything else, because sometimes it's put in with the drugs issue, it's put in with the medical or with the mental health issues. And yes, there is dual diagnosis that needs to be addressed, there's no doubt about it, but I think we need to look at the alcohol issue first. But the services are vital, and we really, really need to look at more residential services in Ireland. And I hope, Minister, that I look forward to working with you on this issue. And I think we can work well together on this issue. But it's one issue that I'm not going to let go of, because that's why I'm here, and I really, really feel that it's important that we make change in this area. So I hope that we can concentrate now more on the services and what services are around this great country of ours. Thank you, Minister.
Thank you very much, Senator. Would you like to respond further?
Thank you very much,
Minister?
Senator Black, and I very much look forward to working with you on this, because I think your expertise in this area is acknowledged. And you know, I'm concerned about the points that you make around the lack of availability in some counties. That's something that is something that I'm certainly very concerned about, and I will follow up on that actually and see, you know, what can be done to fill the gaps that you've identified that are there, because every single county is affected by this, and so, you know, I think if there's services in one county, there should be certainly services in another county to match that. In terms, I suppose, of our own relationship as a society with alcohol, we certainly have to address that. And there's no doubt, I think, that the recognition that alcohol is in fact a drug is something that none of us maybe 20 years ago would have actually recognised. And I think having that conversation now is very timely, and I think it's time for us to actually hold up a mirror to our society and say, well, hold on now, you know, what are we doing to ourselves? What are we doing to our health service? What are we doing to our children? You know, the practices of maybe people consuming alcohol in the home makes it become like another product, where it's not. It's a specific, separate product. And if we have children exposed to that, it becomes the norm. It becomes, you know, if you're doing your grocery shopping and there's a child sitting in your shopping trolley, are you reaching out for your milk on one shelf and alcohol on another shelf, and the child becomes familiarised with this being the norm. And this is where, you know, the path into seeing alcohol as something that's the norm starts. So it's certainly a challenge for us all in society, and the Public Health Alcohol Bill will seek to address a lot of that, and I really look forward to working with you, Senator Black, on this and your contributions when we do come to a committee stage here in the Shannon with the Public Alcohol Bill. Thank you for
Thank you very much.
Today.
Thank you, Senator, and thank you, Minister.